within the healthcare space, a company that has managed to do what many found either impossible or difficult, reimagine healthcare. Please help me welcome a powerhouse in the healthcare space, Dr. Shivon Byamukama, the Managing Director of Babel Rwanda.
Thank you very much for those kind introductions. In 2006, my mother was diagnosed with asthma. In 2006. There was something in her lung, and the doctors found that she had asthma. She was in her late 50s. In 2012, she was diagnosed with lung cancer, stage 4 lung cancer. As many of us would do, you send your loved one to India or other places for further care. And in 2013, we were told that there's nothing we could do. She came back home, and unfortunately in May of 2013, she succumbed to lung cancer. So obviously I'm not naive that even in the best healthcare system, I don't have guarantees that she would be here with us today. But I'd like to focus on the first 6 years, where she was between when she had asthma and then it was stage 4 lung cancer. She did not go to check on the doctor, given the new diagnosis at a late age. She didn't do that. But she's not alone. Very many of us, that's how we experience healthcare. We don't go to check on what we're suffering from. I think these slides are going way fast. We're still on the first slide, apologies. Yes. I think I'll just be saying next slide. So where was I? So she didn't get the care that she needed. But why? I think that all of us know that sometimes it's very inconveniencing. You go to hospitals, they're overcrowded, the wait time is very long, it's an all-day affair. Actually, in 2019, there was a study that showed that in Rwanda, when you go to seek care, at least 30%, you lose 30% of the population lose some kind of income, obviously because you're spending a whole day seeking care. And that's what happens. Next slide. But why? The doctor-patient ratio, as recommended by the World Health Organization, is 1 in 1,000. One doctor per 1,000 population. In Africa, we have about 1 doctor per 5,000 population. And even then, the majority of these doctors work in the cities, and yet we know that 62% of Africa's population live in the countryside. So there's so much that has been done to deal with this situation. In Rwanda, for example, we have community health workers, about 60,000 community health workers. We have health posts and health centers, and that's where really the majority of the primary health care conditions are dealt with. And then you go to see doctors at a more advanced stage, at doctors and tertiary level. That is part of the work that we're doing. Also in Rwanda, under the Abuja Declaration, 15% of the country's budget is spent on health. Rwanda is one of the few countries that has about 80% of its population having universal health care. 80% of our population is universal health care, and about 87% of the population is insured. So that's what we're doing. Next slide. Now, I'd like us to together imagine a world where 70% of Africa has smartphones, has wearables, where we can begin to collect the data that you have, to collect some data, where we can get some insights. We know when you sleep, we know what you eat, we know when you exercise, and together set goals on how to keep you healthy. We together put together a plan and then monitor that. And even have a reward system where we are rewarding you for that. Next slide. So Babylon doesn't have to imagine that, because for the since 2013, this has been our focus, to make sure we make healthcare affordable and accessible to everyone on earth. We're in 15 countries, and Rwanda is the only country we're in Africa. Now, how do we work in Rwanda? So I'm sure all of you have a phone. It might be a feature phone or a smartphone. You dial 811#, book your appointment, and a senior nurse is going to speak to you, is going to call you back and speak to you about the condition that you're suffering from. If it is a primary healthcare condition or something that we can treat, then they'll book an appointment with a doctor, and you'll get treated from the comfort of your home or wherever you are. And then, only then, will they recommend you to do some lab tests or prescriptions, where you can go to some of the 500 health facilities where we have put our platform. In the period that we've been here, we've registered about 2.5 million Rwandans who are registered on our platform. We've had about 2.9 million appointments. 2.9 million appointments. We do about 3.5 to 4,000 consultations every day. We have a partnership with the government of Rwanda to do more of that. We have also partnered with the Center for the Fourth Industrial Revolution to be able to put ethical guidelines in place, because we've now introduced AI in our system. Next slide. This is what our call center looks like in Kigali. These doctors are part-time doctors. They have full-time employment wherever it is they work, and only work with us in their free time. Now, when they work we have about 130 doctors, about 220 nurses that work with us on the part-time. And when you look at the doctor-patient ratio, if you look at the doctor-patient ratio of 1 to 5,000, then you quickly see that these doctors can do more in that short period of time. Next slide. So I would like us to imagine a world where Africa has smartphones. Keep going. Next slide and next slide. An Africa where we are, thank you, where we're looking at, imagine an Africa where we have more smartphones on the continent, where we really start being very proactive with you rather than reactive, where we provide continuous care to you rather than on a must-need basis, where we do value-based care rather than a fee-for-service. We are more patient-centric rather than a provider-centric, where we have AI-enabled capabilities rather than human cognition, where we have personalized care and not one size fits all. That, my friend, is the future of healthcare on the continent. Thank you.